Hello everybody, this is Carlos and welcome to another video. In today's video, we're gonna go over writing reflections using the L.E.A.R.N framework. Now, some of our learning objective will be that students will be able to identify the importance of reflections as nurses. Students will be able to recall and apply what each letter of the L.E.A.R.N framework stands for. And also, students will be able to exemplify their understanding via an example. Now, what does it mean to engage in reflective practice? Reflection is a purposeful process of thinking back and reevaluating what you've done in your nursing practice. It is something that allows us to continue to enhance and improve our strengths in our areas that we might be weak in so that we can provide better patient care. It is an expectation for nurses as part of the mandate from the College of Nurses of Ontario as part of their quality assurance program for all nurses. Now, the L.E.A.R.N framework was actually developed by the College of Nurses of Ontario in 1996. And L.E.A.R.N, the five letters stands for L for look back, E for elaborate, A for analyze, R for revise, and N for new perspectives. So I'm going to use an example that it happened to me when I was a new grad, and I'm going to reflect on my first medication error that I did. So the order, and this is something that I will always remember for the rest of my career because it was my first medication error as a new grad, and I had to do quite a bit of reflection to it so it didn't happen again. So the order, the medication was Gravel 50 milligrams IV as needed for nausea. And what I administered instead was Benadryl 50 milligrams IV. So let's go through the look framework. So look back on this step, you're going to recall and describe a situation that had meaningful impact to your practice as a nurse, either positive or negative, right? So my example will be on my fourth month working as a new grad nurse in a medical surgical unit as a community hospital. I administered the incorrect medication to one of my patients during a night shift, resulting in a medication error from my part. After realizing what happened, I was very anxious and fearful that I might have inadvertently caused potential harm to the patient. So this is looking back into something that was meaningful to me as as a new practicing nurse. Okay, now let's go to the next letter, which is E. Elaborate in this step, you are going to provide specific details of the situation that was meaningful to you from an objective and subjective standpoint. So my example here would be during the night shift in the medical surgical unit, I had 8 patients assigned under my care. One of my patients was nauseous after receiving opioids from pain management after surgery. After completing my assessment, I went over the MAR and looked at the PRN medications, and the patient had an order for Gravel 50 milligrams orally or IV for nausea, and I decided to go with the IV route because I didn't want to stimulate any more vomiting for the patient. So after mixing the medication, I went over the 10 rides, but I briefly remember going over the 3 checks, which I might have not performed all 3 checks accordingly. So I didn't find out that I made a medication error until I went to reassess the patient. The patient still told me he was nauseous, but he was more lethargic than earlier. So when I look at the vial closely, that's when I realized that I gave Benadryl instead of Gravel for the patient. So let's move to our next letter, which is A. Now, A is for analyze. On this step, we're going to describe why things happened the way they did. What were the contributing factors, and what could this potentially affect the patient or in a safety way? So you're going to analyze that part. So as part of my example, I reflected that on retrospect, I know what factors contribute to this medication error, and I identified 3 factors. So one was a human error, my error, right? So I did not carefully do my 3 checks when preparing the IV medication. I grabbed the medication from the bin, and the generic names from Gravel and Benadryl are very similar. So for Gravel, it was dimenhydrinate, and for Benadryl, diphenhydramine. And because they're D and D, they're usually right next to each other, which contributed to the human error from this medication. So second was the workload. Night shift, usually there is significantly higher patient to nurse ratio, and in an acute care unit, um, there is the acuity also on top of that, the acuity and the complexity, which I think it contributed to the medication error as well, because I was trying to rush. And number three, the environment. At nighttime, oftentimes the units, we try to dim the lights to encourage patient to fall asleep and get some rest. And I think that poor lighting contributed also to the visibility and to the medication error as well. So the wrong medication could have potentially harmed patients and prolonged their hospital stays. Absolutely. So R's for revise. On this step, you identify what you think should change and what should remain the same in your practice. So based on my example, by reflecting on my own practice, there are things that I would change and continue. So things that I would change, I will take extra moments to really perform my 3 checks thoroughly. And this means matching it to my MAR and checking the names carefully. I will also engage in the interprofessional team, especially pharmacy, to ask them to flag medication that have very similar name or they have very similar sounding names, especially if they were close to each other, so that they can, so that more of a visual cue could be put in there. And number three, I would probably work in a better lit area with more light, especially during night shift, to increase visibility, so that I can, so that medication can be easily recognized better in that way. Things I will continue to assess my patients prior to implementation of the intervention. So always follow the nursing process, assessment planning, implementation, evaluation. Always do my 10 rights. And for future, I will also reflect on my errors so that I can consciously think about them and also find ways to improve them. Okay. And new perspectives. On this step, you have to identify how I will handle similar situations in the future. So in the future situations, if I did another medication error, I will be more diligent in conducting a thorough assessment, including my 3 checks when preparing and dispensing the medication. I will bring forward my experiences to my colleague, nurse educator, and members of the interprofessional team. I will self-report my error in other words, so that as a team we become aware of what's going on and it's not a situation that happens in silo. I will educate patients on the medication and that I'm administering to the patient, and ask them if they have any questions. So that could also act as another cue to make sure that you're administering the correct medication by telling the patient what you're giving and asking the patient if they have any questions back. Okay. If a future medication incident does end up occurring, I will first assess my patient, make sure that they are safe, and make sure that they're stable. And I will then report the error to the nurse, the physician, or the pharmacist, and enter an incident report. So always follow the policies and procedures of your institution. And remember that errors is a human thing to do, but the most important thing is for us to acknowledge that we made an error so that we can find ways to the solution by first making sure the patient is safe. It is not intended to be punitive, and sometimes errors are not reported because there is this misconception that you're going to be punished for doing the error. But in the contrary, it's trying to find gaps in the care so that we can patch those gaps to uh, one, reduce errors for future situations, and two, to enhance patient care that we can provide. And that is my 2 cents on the L.E.A.R.N framework for doing reflective practice. And just a little warning: please do not plagiarize any portions of the examples. As part of these examples, this is something that I has just come up with, just so that you don't get into any trouble for plagiarism. Okay, always use your own words. And thank you very much, and I'll see you in the next video. Bye for now.